All right, go ahead.
So our presentation is on HIPAA, and it's by me, Kelsey, and Casey and Chad. And to start out with, the privacy of patient information. So one of the major goals of HIPAA is to ensure that individuals' health information is properly protected. They do this to protect the public's well-being and health. Healthcare facilities must always protect the security of
Sorry, I hit my mouse. Do we want to go back since we're right at the beginning? Or I just totally went into it, but I accidentally touched my mouse pad and it went through like a ton of different slides. So, okay, we can
Okay. Is that okay? We start over?
can we cut it? I'm pretty sure we can cut it.
I don't know how to cut it, but I can try.
Do we just start and stop? I'm sorry. I'll make sure
No,
I don't hit my mouse pad.
I
you're
was like,
totally good.
Just end the recording.
Yeah,
We're recording. It's awesome. It's okay.
and we're done. So,
Go ahead, Kelsey.
okay. So our presentation is on HIPAA, and it's by me, Kelsey, and Casey and Chad. And to start out with, we have the privacy of patient information. It's one of the major goals of HIPAA is to ensure that individuals' health information is properly protected. They do this to protect the public's well-being and health. The healthcare facilities must always protect the security of patients' health information and their privacy. Facilities do this by having covered entities that hold patient records. Covered entities have to have a written consent from the patient before they can use or disclose their health information. Why have covered entities? A covered entity is referred to as a health plan. Some of these covered entities include providers such as doctors, clinics, psychologists, dentists, chiropractors, nursing homes, etc. Facilities contract with these covered entities to take care of the administration side of things to provide health care records to patients. Some examples include securely disposing of outdated records, and safely transmitting PHI, which is patient's health information, between various facility entities. So I have HIPAA. It shows who has access to your medical records. It takes special measures to keep your records secure. Shows if medical records are being used without your consent. Provides patients with the opportunity to have all of their medical records with them at home, such as copies or on the computer. How patients may want to amend their medical records, and says how long medical records can be kept by organizations. So there's a 5 policy rule requirement on patient confidentiality, and it's written authorization, special notes from physicians that are protected, chain of trust agreements, designation of privacy officer, and provision of notice to privacy practices. What does HIPAA privacy do for patients? It provides patients with access to certain rights associated with their individual PHI. Providers have to disclose to patients their notice of privacy practices. It allows patients to be able to submit privacy complaints about their own specific providers and healthcare plans. It allows patients the right to see their medical records digitally if wanted. And then what does HIPAA's privacy do for physicians? It not only allows patients with these rights, but it also allows healthcare professional information in a secure way to provide and promote high quality care. It gives physicians guidelines of how long they can keep patient medical records. It gives them an easy way to access medical records, and physicians say that it helps them maintain confidentiality of patients' medical records, keeping them more secure.
so one of the next things that we're going to cover is the portability provision within HIPAA. HIPAA has several different positions that make it easier to make changes to insurance, and we're all probably familiar with these if we have insurance that is offered by our employer. Um, Now, these are referred to as special enrollments. Special enrollments allow for changes to be made to an insurance plan outside of the normal window of allowed changes, what's also called as open enrollment. So once a year or maybe twice a year, companies will have open enrollment where you are allowed to make changes to your plan. Um, the time frame that the special enrollment is allowed differs depending on what is called a qualifying event. So the qualifying events that allow you to make changes to your plan outside of open enrollment are what we referred to earlier as special enrollments. And there are two types of special enrollments. The first is the loss of eligibility of coverage. So that would be if you decline coverage at your employer and you take it with your spouse, and then their spouse loses their coverage, you would be able to enroll in your own coverage. Divorce, a spouse death, if there's a reduction in work hours and you're no longer eligible for the plan that you had selected, or if you move from a group plan service area. And the other type of special enrollment are what are called life events, and that would be marriage or birth or adoption of a child. The enrollment request to be included in that plan must be submitted within 30 days of the qualifying event. And depending on the event, you may have immediate coverage, such as if it's with the birth of a child, or you may need to wait until the first day of the first month after the plan receives the request. There are also some protections from discrimination within that portability provision, and many things have changed in the last couple of years with the Affordable Care Act. Previously, companies would issue what was called a certificate of credible coverage, and that certificate would essentially verify that you had prior coverage, and it would aid you in transferring from one plan to another. Many plans would have a waiting time before any pre-existing conditions would be covered under the plan, and that certificate would allow you to bypass those waiting times. And it would also aid you in transferring any monies that you've paid towards your deductible to the new plan. Now, this has changed recently due to the Affordable Care Act, as companies are no longer allowed to screen out any pre-existing conditions that you have. So if there is a certificate that issued, that's most commonly issued to verify, money that's been paid towards a deductible. Some of the other protections that we have from discrimination are things that can't be used to deny you coverage. So if you fail a physical exam, if they ask you for family medical history, they can't use that genetic information to deny coverage. They can't take the results from a health questionnaire and deny coverage based on what you answer. If you're hospitalized at the time of the plan commencing, they can't use that. A lot of places would be worried that they have to start paying out right when you join. They can't use that to deny your coverage. A history of high claims, say if you had some type of chronic disease or issue, they couldn't deny based on that. And also if you partake in high-risk activities. It is important also to note, though, that those protections apply to group or employer coverage. And if you are purchasing any type of personal insurance or single insurance, they may be able to deny coverage based on some of those things.
So what is COBRA? It stands for the Consolidated Omnibus Budget Reconciliation Act, and it was enacted in 1986 by Congress. It is regulated by the U.S. Department of Labor, Employee Benefits Security Administration, and it is a federal law that extends your current group health insurance when you experience a qualifying event. And the extension period is up to 18 months, but some qualifying events can make it even longer than that, up to 36 months. So what does COBRA do, and how much does it cost? It gives former employees, retirees, spouses, former spouses, and dependent children health coverage at group rates for a temporary period of time, all of which need to meet specific qualifying events like we've said. And it is usually more expensive than health coverage for active employees, but less expensive than individual health plans. And you will cover the premium that was covered by your employer. And you can choose payment plans. From what I read, I think it was yearly or monthly or even weekly if you wanted. And you pay typically 102% of the premium and an administration fee. Qualifying for COBRA. I put some sub-bullets, and the first one is plan coverage. Group health plans for employers with 20 or more employees on more than 50% of its typical business days in the previous calendar year are subject to COBRA. Both full-time and part-time employees are counted to determine whether a plan is subject to COBRA. Each part-time employee counts as a fraction on an employee, with the fraction equal to the number of hours that the part-time employee worked divided by the hours an employee must work to be considered full-time. The next is qualified beneficiaries. A qualified beneficiary generally is an individual covered by a group health plan on the day before a qualifying event who is either an employee, the employee's spouse, or an employee's dependent child. But in certain cases, a retired employee, the retired employee's spouse, and the retired employee's dependent children may be qualified beneficiaries as well. In addition, any child born to or placed for adoption, like Casey said, with a covered employee during the period of COBRA coverage is considered a qualified beneficiary. Agents, independent contractors, and directors who participate in the group health plan may also be qualified beneficiaries. And qualifying events. Qualifying events are certain events that would cause an individual to lose health coverage. The type of qualifying event will determine who the qualified beneficiaries are and the amount of time that a plan must offer the health coverage to them under COBRA. A plan at its discretion may provide longer periods of continuation coverage, like I said before. And here's a little chart or table of qualifying events and the qualified beneficiaries and the maximum period of coverage. If you're terminated, like it says, for reasons other than gross misconduct, or you have the reduction in hours of employment, meaning if you're working full-time and you get bumped down to hours of part-time, the qualified beneficiaries for that are employees, spouse, and dependent children, and that's a maximum period of coverage of 18 months. Employee enrollment in Medicare, qualified beneficiaries are the spouse and the dependent child, 36 months. Divorce or legal separation, the spouse and dependent child, 36 months. Death of employee, spouse, dependent child, up to 36 months. And loss of dependent child status under the plan is the dependent child, which can be up to 36 months as well. And what does COBRA cover and how do I apply? It will cover everything your past group insurance covered. It will basically be identical to the benefits that you got. If your past group insurance benefits change while you are under COBRA, your coverage will follow these updates. And how you get COBRA, you first have to make sure you qualify by looking at the qualifying events. And depending on the situation, your employer could give you notice of what you qualify for. Like if you are being laid off, that's one example of them reaching out to you about COBRA. You can then notify your former employer that you want it by contacting HR, Human Resources. And then once you receive the election notice, make sure you fill it out and return it within 14 days. And there were our sources, and that is the end of our presentation.
Awesome. Great job, guys. That was really well done. HIPAA is a very, very important topic to learn about. I mean, regardless of what you're going into, or whether it's healthcare administration, where it's really important, or even, I know we have a lot of health science students that are in the course as well. Or if you're not even anything related to healthcare, but knowing about your medical record and all that information is huge. So HIPAA is a very, very big aspect. A lot of stuff we do at work, at my work is revolves around HIPAA. We got to make sure that you're not letting patient information get out and things like that, because that's a private thing. So you guys did a really good job. I'm going to ask you all a question that I ask everybody else. So I'll just work my way across the screen. So I'll go Casey, then Chad, then Kelsey. But same question for all of you. It's, what was the biggest thing or biggest surprise or most enlightening thing, whatever you call it, that you learned as you were studying about HIPAA to get ready for this presentation?
I think for me it was the portability aspect. I never knew that that was actually part of HIPAA. I knew that there were regulations on the companies on what they could and couldn't do, but I always had the privacy was more of my notion, exactly what HIPAA basically was made up of. And I didn't know Cobra was part of HIPAA either. So I mean, I thought it was just basically privacy of your records, not necessarily all that it entails with insurance as well. So.
Great, thank you, Chad.
For me, the most surprising thing was Cobra. I've been in the healthcare for almost 7 years, but in EVS. So I knew about HIPAA, but for Cobra, I didn't know as well that it was a part of HIPAA. But I thought that Cobra was just for the employees. And seeing that it's also for other beneficiaries like the employee's spouse and other circumstances like divorce was really surprising to me. And in the beginning of this semester, we have a hospital that was closing down their OB and maternity, and nurses lost their jobs. And I found it funny that I ran into a nurse who needed help finding HR, and she just started talking to me about Cobra, and I was like, that's funny because I'm doing a presentation on Cobra.
Yeah.
But it's really interesting, and
Great.
I never knew that.
Great, thank you, Kelsey.
So I would say that it was probably about covered entities. Like I knew about HIPAA and everything, but I didn't really know that they had an actual like health plan, which was like the providers and stuff had to go through these covered entities to be able to like see documents and like dispose of the documents that they had, or to transmit them to other facilities or other doctors, or just kind of like whatever they were going to do with their records. They really had to like be really secure and really know where they were going, and they had to go through these covered entities to get their documents securely over to other facilities or other doctors or whatever it may be, and just like how long they can keep medical records, stuff like that. So I thought it was really cool that they're like really secure, is what it sounds like.
Oh yeah, it's something that needs to be super, super secure.
Yeah, and it definitely seems like it was. Like everything I read was like, it's really secure. So
Yeah, like just if I can interject real quick on that, like my wife works in an ER, and like they've been told if she were even to look at my records as a spouse, she would be fired.
Oh,
So,
wow.
and they have like people that's their whole job is to monitor and make sure that no funny business is going on with the records at the hospital from the employee end. So, I mean, it's super, super crazy.
If I can interject real quick, sorry. But I've noticed we have WOW stations that nurses use, and they're portable, they can take them wherever, but that it will, if you try to access a different patient's records that you're not taking care of, it will pop up a message saying, are you sure you want to view this? So they're really watching what you're doing and making sure you're not getting into those private patients' information.
Oh yeah. Well, I mean, great. I mean, great answers there. I mean, that's fantastic. When you look at just the fines that are associated with breach of information, they're incredible. And what a lot of employees don't understand also, as Casey mentioned, if his wife were to look up his medical records, she could get fired. Yeah, employees can get fired, but they can also be prosecuted for letting a breach happen or getting into other patients' medical records, and they don't really understand that a lot of the time. So it's a big deal, and that's why they keep things really, buttoned up tight. The most recent, hacking thing we've seen in the healthcare industry. Have you guys ever heard of anything called ransomware?
Yeah.
So basically, it takes your medical record hostage, and they ask you to basically pay a certain amount of money, a lot of money, so they don't release your medical record information and have that breach. So it's a big deal. HIPAA is a really big deal. So, all right, great job. I'm gonna go ahead and stop the broadcast really quick, the recording.